know, I'm feeling really good about the race this weekend. I've gotten my time down, and it looks like the weather's gonna be good.
Yeah, it's supposed to be beautiful on Saturday. And you've been running really well. You've actually been pushing me.
If I do well this weekend, I'm actually thinking about starting to train for the marathon.
Hey, count me in for that. I've always wanted to train for a marathon, but I didn't want to put in all the work by myself. Besides, it'd be great to have a buddy to train with. By the way, how's work going? Not that bad, huh? Kelly! Kelly! Kelly, what's wrong? Are you okay? Kelly! Somebody help!
Every 90 seconds, another person dies from sudden cardiac arrest. But thanks to the quick actions of people like you, dedicated to learning how to save a life, Kelly will live to run again.
Let us through. Everybody step back, please. Scene is safe. We can take it from here, sir.
Boy, you guys got here quick.
Hey, can you hear me? Are you okay? He's not responding. He's not breathing normally, just gasping. Grab the AED. There's no pulse. 1, 2, 3, 4, 5,
Remember,
6,
push hard
7,
and
8,
fast.
9,
At least
10,
2 inches or
11,
5
12,
centimeters.
13, 14,
His chest
15,
needs to
16,
completely
17,
recoil
18,
after each
19,
compression.
21, 22, 23, 24, 25, 26, 27, 28.
Analyzing
Everybody clear?
heart rhythm. Do not touch the patient.
Let's switch now.
Shock needed. Charging. Stay clear.
AED
of
says shock
patient.
advised. Everybody
Press
clear?
the flashing button now. Shock delivered. Begin CPR.
1, 2,
Start
3,
with
4,
compressions.
5, 6, 7, 20, 21, 22, 23,
Analyzing
24,
heart rhythm.
25,
Stay
26,
clear
27,
of
28.
patient.
Let's switch again.
Shock needed. Stay clear of patient. Charging. Press the flashing
Everybody clear?
button now. Shock delivered. Begin CPR.
1, 2, 3,
Start
4,
with
5,
compressions.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 19, 20, 21, 22, 23, 24, 25,
Analyzing
26,
heart
27.
rhythm. Stay clear of patient.
Everybody clear? Let's switch.
No shock needed.
He's breathing, and it's normal. There's a pulse.
Let's get ready to transport.
I thought I was in great shape. I mean, here I am toying around with the idea of running a marathon, and the next thing I know, I'm in the back of an ambulance on my way to the hospital. I mean, how do you say thanks? Those people saved my life. There's no doubt about it. I am so grateful to those rescuers. They knew exactly what to do. Eddie said that they were there within minutes, and they performed like a well-oiled machine.
What you've just seen is a textbook rescue, performed by a well-trained professional team. Today, you're going to learn to react and perform at the same level. On any given day, you could come across a victim of cardiac arrest, where your actions and training can determine the outcome. Beginning with the scenario you've just witnessed, you're going to learn basic life support, or BLS, for healthcare providers. You'll learn how to initiate the chain of survival, recognizing cardiac arrest and activating the emergency response system, perform 1 and 2 rescuer adult CPR with breathing devices, and use an AED. Later, you will learn how to perform child CPR, infant CPR, and how to assist a person who is choking. The AHA has adopted, supported, and helped develop the concept of emergency cardiovascular care systems for many years. The term chain of survival provides a useful metaphor for elements of the ECC systems concept. The 5 links in the adult chain of survival are immediate recognition of cardiac arrest and activation of the emergency response system, early CPR with an emphasis on chest compressions, rapid defibrillation, effective advanced life support, and integrated post-cardiac arrest care. The 5 links in the pediatric chain of survival are prevention of arrest, early high-quality bystander CPR, rapid activation of the EMS or other emergency response system, effective advanced life support, and integrated post-cardiac arrest care. But the most important link in the chain of survival is you. The 2010 AHA Guidelines for CPR and ECC recommendations for healthcare providers include the following key changes and issues: changes in BLS sequence, continued emphasis on high-quality CPR with minor changes in compression rate and depth, additional changes around cricoid pressure, pulse check, and AED use in infants. Let's review each of these in detail. The 2010 AHA Guidelines for CPR and ECC recommend a change in the BLS sequence of steps from ABC, airway, breathing, chest compressions, to CAB, chest compressions, airway, breathing, for adults, children, and infants. In the ABC sequence, chest compressions were often delayed while the rescuer opened the airway to give mouth-to-mouth breaths, got a barrier device, or gathered and assembled ventilation equipment. By changing the sequence to CAB, rescuers can start chest compressions sooner, and the delay in giving breaths should be minimal, only the time required to deliver the first cycle of 30 chest compressions, or approximately 18 seconds. For two-rescuer infant or child CPR, the delay will be even shorter. Another key change is the removal of the look, listen, and feel for breathing from the assessment step. The healthcare provider should not delay activating the emergency response system, but should check the victim for 2 things simultaneously: response and breathing. With the new chest compression first sequence, the rescuer should activate the emergency response system and begin CPR if the adult victim is unresponsive and not breathing, or not breathing normally, only gasping. For the child or infant victim, CPR is performed if the victim is unresponsive and not breathing or only gasping. For victims of all ages, except newborns, begin CPR with chest compressions, CAB sequence. After the first set of chest compressions, open the airway and give 2 breaths. The 2010 AHA Guidelines for CPR and ECC once again emphasize the need for high-quality CPR, including a compression rate of at least 100 per minute. This is a change from approximately 100 per minute. A compression depth of at least 2 inches or 5 centimeters in adults, and a compression depth of at least 1/3 of the anterior-posterior diameter of the chest in infants and children. This is approximately 1.5 inches or 4 centimeters in infants and 2 inches or 5 centimeters in children. Note that the range of 1.5 to 2 inches is no longer used for adults, and the absolute depth specified for children and infants is deeper than in previous versions of the AHA Guidelines for CPR and ECC. Complete chest recoil, minimizing the interruptions in compressions, and avoiding excessive ventilation continue to be important components in high-quality CPR. To further strengthen the focus on high-quality CPR, the 2010 AHA Guidelines for CPR and ECC stress the importance of training using a team approach to CPR. The steps in the BLS algorithm have traditionally been presented as a sequence to help a single rescuer prioritize actions. There is increased focus on providing CPR as a team because resuscitations in most EMS and healthcare systems involve teams of rescuers, and rescuers performing several actions simultaneously. For example, one rescuer activates the emergency response system, while a second begins chest compressions. A third is either providing ventilations or retrieving the bag mask for rescue breathing, and a fourth is retrieving and setting up a defibrillator. There are several additional changes in the 2010 guidelines. The routine use of cricoid pressure in cardiac arrest is not recommended. Although cricoid pressure can prevent gastric inflation and reduce the risk of regurgitation and aspiration during bag mask ventilation, It may also block ventilation. 7 randomized studies show that cricoid pressure can delay or prevent the placement of an advanced airway, and that some aspiration can still occur despite using cricoid pressure. The second additional change is a de-emphasis of the pulse check for an infant or child. It can be difficult to determine the presence or absence of a pulse within 10 seconds, especially in an emergency, and studies show that both healthcare providers and lay rescuers are unable to reliably detect a pulse. Healthcare providers may take up to 10 seconds to attempt to feel for a pulse. If, within 10 seconds, you don't feel a pulse or are not sure if you feel a pulse, begin chest compressions. The third additional change is the use of an AED for infants. For infants, a manual defibrillator is preferred to an AED for defibrillation. If a manual defibrillator is not available, an AED equipped with a pediatric dose attenuator is preferred. If neither is available, you may use an AED without a pediatric dose attenuator. For more detailed information and references, read the 2010 AHA Guidelines for CPR and ECC, including the executive summary published online in Circulation in October 2010. You can also review the detailed summary of resuscitation science in the 2010 International Consensus on CPR and ECC Science with treatment recommendations, published simultaneously in Circulation and Resuscitation. As you can see, those are some pretty significant changes. Right now, we're going to pause the video to give you an opportunity to ask questions. High-quality CPR improves a victim's chances of survival. There are several critical elements of high-quality CPR you should remember. Start compressions within 10 seconds of recognition of cardiac arrest. Push hard, push fast. Provide compressions at a rate of at least 100 compressions per minute and at a depth of at least 2 inches or 5 centimeters for adults. Allow complete chest recoil after each compression. Minimize interruptions. Try to limit interruptions in compressions to less than 10 seconds. Give effective breaths that make the chest rise. Avoid excessive ventilation.
There's no pulse. 1, 2, 3.
CPR begins with compressions. Because compressions are so important to a victim's survival, they need to be started immediately, within 10 seconds of recognition of cardiac arrest. Early CPR keeps the oxygen and blood flowing to the heart and brain, creating valuable life-saving time until spontaneous circulation is restored.
1, 2, 3.
To be most effective, CPR should be performed as a team with rescuers completing many tasks simultaneously. However, in order to be an effective team member, you need to master the individual skills of one rescuer CPR.
Let's switch now.
For this training, we will isolate the individual skills rescuers perform and then put them together, so you'll be prepared to deliver high-quality CPR and use an AED as a team.
Coming through. Stand back, please. Scene is safe.
The first step of BLS is assessment and scene safety. The first rescuer who arrives at the side of the victim must quickly be sure that the scene is safe. The rescuer should then assess the victim for a response and breathing.
Hey, are you okay? Can you hear me? He isn't responding. Isn't breathing normally, just gasping. Grab the AED.
If the rescuer is alone, he or she would then call for help and get the AED. The next step is to check for a pulse. To perform a pulse check in the adult, feel for a carotid pulse.
No pulse.
This technique is usually easier to perform on the side near the rescuer. Locate the trachea using 2 or 3 fingers. Slide these fingers into the groove between the trachea and the muscles at the side of the neck, where you can feel the carotid pulse. Perform the pulse check for at least 5 seconds and no more than 10 seconds.
2, 3.
If you do not definitely feel a pulse, immediately begin CPR, starting with chest compressions, CAB sequence. Now we're going to learn how to do chest compressions. Just watch now. We'll practice momentarily. Position yourself at the victim's side and make sure that the victim is lying face up on a firm, flat surface. Quickly move or remove all clothing from the front of the chest. You will need to be able to see the chest and later attach an AED to bare skin. Put the heel of one hand on the center of the bare chest over the lower half of the breastbone. Then put the heel of your other hand on top of the first. Your shoulders should be right over your hands and your elbows should be straight. Push hard and fast. Press down at least 2 inches or 5 centimeters with each compression. This requires hard work. For each chest compression, make sure you push straight down on the victim's breastbone. Deliver compressions in a smooth fashion at a rate of at least 100 compressions per minute. At the end of each compression, make sure you allow the chest to recoil completely. Chest compression and chest recoil times should be approximately equal. Right now we're going to pause the video to allow you to get into position to practice with the mannequins and learn the skills of CPR. Okay, now that you're in position, let's begin. Follow along with video footage as you practice and switch students on the mannequins when the video instructs you to. You're going to perform 5 sets of 30 compressions at the rate of at least 100 per minute, counting out loud as you press. Counting out loud helps you and other rescuers keep track of compressions. Are you ready? Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now you're going to learn another part of CPR, opening the airway and giving breaths.
23, 24, 25, 26, 27, 28, 29, 30.
In a 2-rescuer scenario, you would use a bag mask for giving breaths. You will learn how to use the bag mask in a moment. During this course, for any 1-rescuer activity, you will be using a pocket mask. When practicing 2-rescuer scenarios, you will always use a bag mask. Finishing her compressions, Kate quickly places the mask with one-way valve on the victim's face. She delivers 2 breaths and returns to giving compressions in less than 10 seconds.
1, 2, 3, 4.
Now let's watch as Kate demonstrates the proper technique for using a pocket mask. Place the mask on the victim's face, using the bridge of the nose as a guide for correct position. Seal the mask against the face by placing the index finger and the thumb of your hand closest to the top of the victim's head, along the edge of the mask. Place the thumb of your other hand along the lower edge of the mask. Place the fingers of that hand under the bony part of the lower jaw near the chin. Open the airway using a head tilt chin lift. Lift the jaw to bring the chin forward. This will lift the victim's tongue, relieving a possible airway obstruction. Do not use your thumb to lift the chin. Also, do not press deeply into the soft tissue under the chin because this might block the airway. Press the mask down and lift the jaw to hold the mask tightly against the face and give 2 breaths while watching for chest rise. Actually seeing the chest rise with each breath is the best way to ensure your breaths are effective. Each breath should be delivered over 1 second. Right now, we're going to pause the video to allow you to get into position to practice with the mannequins and learn the skills of opening the airway and giving breaths. Okay, now that you're in position, let's begin. Follow along with the video footage as you practice and switch students on the mannequins when the video instructs you to. We'll practice 5 sets of 2 breaths along with the video. Are you ready? Here we go. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths. Give 2 breaths. Now let's practice compressions and breaths together, using a pocket mask with a one-way valve. Remember to push hard and fast, pressing down at least 2 inches or 5 centimeters at a rate of at least 100 per minute, and allow complete chest recoil. You also want to give the 2 breaths and return to chest compressions in less than 10 seconds. You should already be in position, so practice along as we combine both steps into one sequence. We'll do 5 cycles of 30 compressions, combined with 2 breaths. Are you ready? Here we go.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now let's take a look at the complete BLS sequence for one rescuer with the initial assessment followed by cycles of compressions and breaths. Just watch now. You'll have a chance to practice all these steps together momentarily.
Hey, are you okay? Activate the emergency response, grab the AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.